Good afternoon, and thank you for joining us for the Bright Futures 4th Edition Implementation for Adolescents 11 to 21 Years of Age webinar presentation. This webinar is the 4th webinar of a 5-part series on adolescent health topics, including the following. Dr. Rachel Caskey, who will be the presenter of this presentation, has no financial relationships to disclose prior to presenting. Funding for this webinar is provided in whole or in part by the Illinois Department of Public Health, OWHFS Maternal and Child Health, Title V Block Grant. This webinar is also approved for CME credit through the ISMS, to provide continuing medical education for physicians. It is approved for a maximum of 1 AMA PRA Category 1 credit. It is also approved for CE credit through the Illinois Department of Human Services, Division of Developmental Disabilities, and it's approved from 1 continuing education credit for the following licensed professionals. The webinar series planning group consists of Dr. Sarah Parvinian, Dr. Caskey, Ms. Sanabria, Olivia Phillips, and the CME reviewers were Drs. Karen Judy and Dr. Matthew Leichner. And none of the planning group or CME application reviewers have financial disclosures. This webinar is being recorded and will be made available immediately following the webinar at our website at illinoisaap.org. For more information, please contact myself at ophillips@illinoisaap.com or at 312-733-1026, extension 209. You are muted during this presentation, and so if you have a question, please be sure to type it in the chat box and make sure to hit send to all so the group can see, or if you would have a direct question to myself or Dr. Caskey, you can select her or myself, and the question will go directly to us. And we will answer questions at the conclusion of the presentation. The evaluation for this webinar will be emailed through a link, and you'll be able to complete that online. Once the evaluation is submitted to myself, we will then send participants a certificate of participation for your records, and this will occur the week of May 6th. Resources for this presentation is brought to you from Bright Futures and also the National American Academy of Pediatrics. So, just as a short introduction for our presenter, Dr. Rachel Caskey is an associate professor at the University of Illinois at Chicago, College of Medicine and School of Public Health. She's also the chief of the Division of Academic General Internal Medicine and Geriatrics at UIC. She is board certified in both pediatrics and internal medicine and is also a primary care provider for all ages. The objectives that you'll learn through this webinar is describing key clinical content from Bright Futures guidelines for the adolescent years of 11 to 21 years of age, identifying leading evidence-based approaches for providers to address the social determinants of health with adolescent patients and their families, and also utilizing practical information, tools, and resources during well-child visits. I'll now turn over the presentation to Dr. Caskey.
Thank you so much, Olivia. It is a pleasure to be with you all via phone today. Olivia, do those slides look okay from your end?
Yep.
Okay, great. So let's start on Bright Futures. And I realize many of you on the phone who are providers for kids, work in a clinic that provides care for children, probably know a fair bit about Bright Futures. But I thought this was a good opportunity to just remind everyone about this resource, and talk about also practical ways in which it can be used, as well as perhaps some of the components of Bright Future that you may not currently use in your practice. So in general, Bright Futures is a set of principles, strategies, and tools that are theory-based, evidence-driven, and systems-oriented with the goal to improve the health and well-being of all children through culturally appropriate interventions that address current and emerging health promotion needs at the family, practice, community, and health system and policy level. Now, I realize that sounds quite lofty, and in the way these are executed in most of our practices is not at all of those levels. But nonetheless, they're designed really to provide that input at all levels of healthcare. The mission is to promote and improve the health, education, and well-being of infants, children, adolescents, families, and then ultimately, hopefully, our communities as well. The guidelines of Bright Futures address the healthcare needs of all children and adolescents, including children with special healthcare needs, as well as children from diverse cultural and ethnic backgrounds. And this is an area where I believe the newer versions of Bright Futures have really done a great job at providing a much greater wealth of information related to children from diverse backgrounds. It is a resource for pediatric providers or providers that care for children, as it brings attention to health promotion activities, psychosocial factors of health, and the focus on youth and family strengths. So it's an asset-based model, which I think is a really important model for pediatrics, particularly for adolescent health. Bright Futures recognizes the need for coordinated medical efforts among medical and non-medical professionals, as well as agencies to effectively promote health and wellness among children and families. While clinicians are certainly encouraged to use Bright Futures, this resource also contains relevant information, tools, and resources for a variety of audiences or stakeholders. For example, in addition to providers, home visiting staff, community mental health providers, school nurses, pediatric educators, residents, trainees, state and local public health programs, policymakers, and families, and the list goes on. So certainly all of these audiences have an important role to play in keeping children healthy and safe. And each of these groups may use Bright Futures in different ways, but it is designed to be that broad. From its inception, the Bright Futures Guidelines have had a rich history with many contributors, as you can see with the timeline over the years. The current edition, which is the 4th edition, is a combination of insights from a multidisciplinary child and adolescent healthcare professional team, including families who served on the Bright Future expert panel to focus on all aspects of the resource. So understanding the changes in the 4th edition of Bright Futures can assist clinicians, professionals, families with being able to reference even more content for best practices and really know how to use the information most efficiently. So the theme of the most recent edition is called Promoting Lifelong Health for Families and Communities. And it has added as a new health promotion topic. It provides a current review of the science of development and insights for how this science might be applied to our practice. So really the focus on the science of human development, ultimately stressing the data that proves what pediatricians have always believed to be correct, that early life experiences matter. They're very important, not just early life experiences, but perhaps even prior to birth. Exposures, that maternal exposures prior to pregnancy, during pregnancy, and then on afterwards. And as I know, I'm sure all of you on the phone see this in your practice regularly. We know that the environments in which children are exposed play a huge role in their health and well-being, far more than genetics or any other factors. The 4th edition also places emphasis on social factors that can affect the health of children, such known as social determinants of health. While social factors are not new issues for healthcare professionals, new science stresses the importance of assessing and addressing these areas and using evidence-based research for effective interventions when available. Additional updates just to keep in mind include, with a particular emphasis on adolescent screening, include guidelines for how to manage cervical dysplasia during cervical cancer screening, depression, mental health needs, dyslipidemia, which is now becoming a common chronic condition, hearing and vision needs, tobacco use, and certainly over time this needs to include the use of electronic tobacco delivery mechanisms as well, alcohol, drugs, and of course many other topics. As many of you are familiar with, I'm sure, the periodicity schedule is a resource that provides recommendations on what to screen for and do at each well child visit to promote optimal health. The Bright Futures guidelines are linked to this schedule. So the AAP puts out the periodicity schedule, and Bright Futures uses that schedule to craft their recommendations. As you can find, the periodicity schedule is published on the AAP Journal Pediatrics. If you're interested, they publish a new version every year. Usually they add some additional screening and so forth. There's often not substantial changes year to year, but those are available every year in the Journal Pediatrics, and it is publicly available. So, well visits, and I know there are multiple terms for this. We're going to focus today on adolescents, and so some of you might call it a well child exam for an adolescent. You may call it a well adolescent visit, preventive health care visit, health supervision visit. All of these terms are synonymous, and we use different terms in our practice. And so just think of these as whatever term you use is fine. That's what we're talking about when it is not an acute visit, not a problem-focused visit, but really a preventive health visit. And as you all know, this is really an opportunity, ideally, to monitor growth, development, and provide anticipatory guidance to individuals and families. The Illinois Department of Public Health works to stress the importance of well child visits across the state, with an emphasis on adolescent well child visits. The goal is to help children grow healthy and strong, of course. Regular well child visits are an opportunity to build trust and communication between parents and providers, as well as to provide important education. We are going to look into, for the next portion of this talk, we're going to look into the role that different clinicians and health professionals have when it comes to these well adolescent visits. And we're also going to touch a little bit on what families can expect and ways you can use Bright Futures as a resource to families. And I will acknowledge that's something I have not always done in the past. I've used it as a resource for clinicians, but I have not maximized its use for a resource for families. And I think this is a really valuable contribution. So before we get into the nuances of Bright Futures, let's just take a step back and talk about adolescent healthcare in the U.S. And when I say adolescent healthcare, we're focusing today on these well adolescent or preventive care visits. And one of the important things to know is that adolescents do not receive preventive care visits the same way younger children do. And so recent data from 2017, and this is from Medicaid and CHIP, looked at the percent of adolescents 12 to 21 receiving at least one well care visit. So that would have been from claims data, something coded as a preventive care well child visit. And you can see that, first of all, there's a lot of geographic variation. But overall, at most, the states that do the best still probably hover between 55 and 69. So let's just say around 60% of adolescents would get a preventive care visit in a year. And for many states, it's actually much lower. A colleague of mine, Dempsey, in Michigan, did similar research, and this is data also from Medicaid in Michigan, but it breaks it down by age group and looks at in a 2-year period. They looked at in a 2-year period the percentage of adolescents by age who received a health maintenance exam or preventive care exam. And as you can see, it's less than 15% across the board receive a health maintenance exam in a 2-year period. So this is really important. One of the first things we need to understand when we think about preventive care for adolescents is that adolescents don't receive care in a pattern similar to younger children. Yet the environment in which we expect them to is really based on the care for younger children. So as we're all very familiar, our infants come in quite often. Toddlers and younger children come in frequently, at least once a year. And that pattern, that periodicity that the AAP has recommended works very well for newborns, infants, and children. And it works well for a few reasons. One is it's also paired, as you know, with the vaccine schedules, which are needing to occur regularly for booster shots and so forth. So that's one of the reasons that really encourages participation in the schedule. In addition, Paperwork is often needed, the physical exam paperwork for daycare centers, preschools, and then, of course, matriculation into kindergarten in the state of Illinois. So there's lots of drivers for younger children that really promote routine well child visits. This is not the same for adolescents. In fact, adolescents, as you can see from these two components of data, at most half, but it could even be less than half, receive a preventive health care visit in a year. And that is because life changes so much for adolescents. And so pulling your kindergartner out of school for a half day to come in and see me is fairly inconsequential for most of us. But pulling my junior high or high schooler out of school for a half day to come and see the doctor causes families to pause, right? And for good reason. The stakes are much greater. Missing a day or a half day of school is less desirable as our children get older. In addition, they're busy, right? Our adolescents are busy. They're involved in a lot of things. And so it often falls off the radar of parents that this is still sort of a routine recommendation for care. Now, what's interesting is that though adolescents are not receiving regular preventive care, they are receiving care. So the same data showed that 80% of adolescents across the board, as you can see at all ages, received at least one interaction with the healthcare system. And often, many of those were office visits. They were just problem-focused office visits. Came in for a sprained ankle after football practice, a sore throat, a UTI, et cetera, et cetera. So one of the things to take away is that the pattern of utilization among adolescents mirrors that of adults, not children. So we really have to think about the way we take care of adolescents in a different framework than the way we take care of 3-year-olds, 5-year-olds, 6-year-olds. And we have to really capitalize on opportunities we can interact with them. If they're coming in for a sprained ankle, perhaps we need to use part of that for some preventive care and so forth. In addition, because their utilization pattern is much more like adults, we also need to think of ways we can be more accommodating to adolescent schedules. And so there's been a push to say, well, what do we do for adults? We provide weekends. We provide evenings. We try early mornings. We try to be more flexible to accommodate their life and needs. And so these are just thoughts I want to leave you with as we think about ways to improve access for our adolescents, so that we can utilize things like Bright Futures and so forth. So let's get into clinicians and health professionals. So well child visits, adolescent, as you know, we can call these any sort of term you'd like. They're really an opportunity for providers to track growth and development, provide education, review and discuss important areas for the family, as well as that we deem important, whether that's for screening, development, and so forth. And perhaps focus very specifically on chronic disease management, which is also becoming more common. During these adolescent visits are important areas of the individual's development, including physical, cognitive, emotional, and social development. So as a provider during these visits, you can discuss preventive strategies to reduce harm from injuries or illness. Emphasize during these visits should certainly be on healthy behaviors. So let's think a little bit about early adolescence. And this is often categorized as the onset of puberty, typically beginning around, somewhere around 9 to 11, usually up to age 14. Physical and cognitive changes are occurring during these years. Youth with special healthcare needs may experience puberty at the usual time, or they can have an earlier or delayed onset of puberty changes based on their health conditions. Main priorities at this age include addressing concerns from the parents and adolescents, of course, as that would be the case at any age. Determine healthcare needs. Other things to think about, of course, are social determinants of health, food security, living conditions, interpersonal violence, family history, community, school performance, all the, many things we might screen for with both the adolescent and their family members. Physical growth and development are, of course, important. Healthy eating, physical activity, oral health, and body image starts to become important at this age. The fixation on body image really starts to peak actually at the end of early adolescence, the beginning of middle adolescence. Emotional well-being, including mental health, is critical. And then, of course, risk reduction. And risk reduction is going to be very specific to different adolescents. This could be a risk, depending on their age and developmental stage, starting to talk about traditional risks like substance use, tobacco use, intimate behavior, sexual activity, or it may be things like being cautious with using earbuds for acoustic trauma, which are so common these days, right? It's all of our kids are connected and they have their earbuds in and so forth. So, of course, that's going to vary a lot. And then safety is important at every age. And again, that's going to vary depending on the needs of the adolescent and their developmental stage. Certainly, we think about things like seatbelts and helmets, but I think we also have to think about firearm safety as adolescents may live in environments where they may come in contact with firearms certainly that are not theirs, but that are owned by other individuals in the household. Middle adolescence, which we're really looking at sort of that 15 to 17 years old, is a time of continued rapid development, both physically, cognitively, emotionally, and socially as well. Usually high school and its associated activities become a central part of the lives of most middle adolescents. Many adolescents begin working either after school or on weekends around this time. Youth with special health care needs are often mainstreamed and are able to take advantage of educational opportunities at large schools. Youth who experience cognitive challenges may be eligible to extend their public school eligibility through age 21 as well, which is important that families know that. So associated priorities are very similar to early adolescence. We're focusing on social determinants of health, growth, development, risk reduction, and so forth. So again, the topics are very similar. We start to think too about high school graduation and dropout rates, and if that is a risk, if that child might be at risk. Body image conversations can be important. Friendships and interpersonal relationships are more important at this age as adolescents are becoming more intimately involved with others. And so screening for safety within those relationships, positive relationships, safe relationships, and so forth, as well as developing a sense of sexual orientation can become important at this age as well. Mental health concerns remain important at every age. Late adolescence, which is really 18 and up, we don't really put a cap on that. Some will say early 20s. I mean, I have some colleagues who swear, late adolescence goes to like 30. So we won't worry about the upper age limit of late adolescence. But of course, this is a unique time in that now these individuals are legally able to consent for themselves. Right now, they're considered the age of majority in our country. They've generally completed physical development. So most are going to be at their already achieved full adult height. All of their secondary sexual characteristics have fully developed. And they have a much more robust sense of identity in their late teens, early 20s, become much more rational, realistic, and refined moral and religious values as well. So the healthcare needs of young adults can vary greatly and are going to vary by the individual. Certainly some of the same issues we think about for early and middle adolescents are still important. We worry about their development. We worry about their achievements in life and their exposures. Are they in positive living environments, interpersonal relationships, and so forth? Young adult health visits, of course, start to decrease, right? So as I showed you, adolescent health visits aren't great, but they become even fewer after individuals turn 18. That can be for a number of reasons. One is they're feeling fine, they're generally healthy, and they're out in the world. Some lose insurance coverage if they were if they were publicly insured. They may lose their coverage. And some don't have the option of having parents that are on commercially provided plans, so they may not have options for healthcare coverage. And they may also just be off at school, right? We have some that are off at college or school, and so they're not getting the routine care they were when they were younger. I think successfully transitioning them into this new phase of life is important, making sure they know it's still important to come in at least periodically for care. And even if that is not happening nearly as often, that they should check in when needed, particularly focusing on anticipatory guidance that is critical at this age. And this might be things like reproductive health planning, making sure our youth that are going off to jobs or for school are prepared and have everything they need. Certainly, they are now legal adults, discussing confidentiality and also explaining that they have to provide consent, no longer their parents, and their parents and caregivers really cannot be provided information without the young adult's explicit consent. So let's talk a little bit about families, and this is information on how to think about using Bright Futures with families in your practice. So during a well visit, family caregivers, there's a lot of things that are available for families in terms of anticipatory guidance. And so there are resources in Bright Futures that will allow families to, that can be given at the time of or prior to the visit, that give families information on what to expect. So what to expect in terms of a physical exam is going to be done. Immunizations may be needed depending on age. Screening that would be reasonable at that particular age, whether it's blood pressure, heart rate, perhaps cholesterol or blood sugar screening, depending on the age and comorbidities and so forth. These resources also provide families ideas on questions or things to bring up during the visit. And again, that's going to be individual by family, but gives them good ideas of things to think about. So in early adolescence, these resources will focus both on things their children should think about and then what the parent or caregiver could think about. And the resources for children might be things like, responsibilities at home and school, talking about friends, focusing on friendships and healthy relationships, health problems, concerns, and so forth. And the parent caregiver resources will talk about, have them reflect on their child's physical well-being, feelings and behaviors that are contributing to emotional well-being of their children. And if they're having any concerns about risky behavior or just thinking about that for the future, right, when that may be more likely. Similarly, middle adolescence resources for the teen could be just reminding teens to think about if they have any particular questions or concerns about their developing body that they may want to ask in confidence. How are things going with family, friends, school, work, and so forth? And then any other questions they might want to talk about. Similarly, the parent and caregiver is similar, children's physical well-being, their feelings and behaviors, if parents have any concerns about their child's emotional well-being, and also about risky behaviors, which at this age may sort of be at the pinnacle, right? These are often the years, this 14 up to 17, where teens are the most likely to be experimenting with different behaviors, and the parents often are most concerned about them doing so. And so a lot of times parents may have even more concerns than their children do, their adolescent children, about these behaviors and how to monitor, keep them safe, and so forth. And late adult adolescence is, of course, different because now the young adult is the patient and the legal patient. So, again, it's focused on medical questions or concerns, worries they have, social scenarios, and then really more planning for the future, education, employment, relationships, and what anticipatory guidance is needed as they go into their young adulthood. For parents and caregivers, certainly they may have lots of questions or concerns, but they would not be necessarily directly involved in this visit unless the adolescent invited them in. And certainly many do. I have many patients who are over the age of 18 that actually want their mom to still be involved or feel very comfortable having her part of those conversations. And so again, we let the patient, of course, dictate how that happens. Youth with special healthcare needs experience developmental, social, emotional, and physical changes at different times depending on their needs, or it could be at the same time as others. Family and caregivers can speak with their providers about the needs for their child's individual needs based on their developmental stage. And then all information should be inclusive and appropriate. Patients and caregivers should also feel comfortable, of course, asking questions, as they should regardless. So some tools and resources. This is just an example of what Actually, I'm going to start here. So this is an example of what you can find actually online. This is on the AAP, and these are age-based screenings and priorities. And as you can see, there are screening and priority tables based on the age groups, right? And this is just an example of what such a table looks like. And so this is an adolescent visit. Now, it's a wide age range, as you can see at the top, and it goes into universal screenings. It also goes into medical history risk factors, risk assessment by more specific age groups, and so forth. And again, this is just a snapshot of a part of this section. It will go on more pages, but it just gives you a sense of what this would look like. The providers and, of course, families can find all of this online, as well as the resources. There's resource kits here that have pre-visit questionnaires that can be used if that's something that might be meaningful in your practice, where perhaps it's given at the visit prior or sent out ahead of time, where patients and families can fill this out together. Again, really focusing on, are there any concerns, questions, highlighting some areas that will likely be covered during the visit and so forth. So that's just something available. And all of these family resources I mentioned are also available through a download on the AAP website. And these, again, are by age group, and there's sections for the adolescent patient as well as the parent or caregiver. And these might be things that are valuable to use in your practice to give out as education or anticipatory guidance. Here are additional resources on coding for pediatric preventive care visits. And I think most people who care for children get pretty comfortable coding for preventive care visits, but it's available. The link is here on the slides. If you need it, it's through the AAP. And it just provides some insight focused on, of course, ICD-10 as well, on CPT codes to use, when you might want to use one code versus another, and so forth. I think this becomes particularly important as our adolescents are more likely to have chronic disease these days. And so if we do have the opportunity to do a preventive care visit with them, we're often not just doing the preventive care, we're also addressing their borderline high blood pressure that we've been worried about for 2 years, and perhaps their obesity and these other things. And so depending on your payer mix and how you code in your practice, you could also learn more about using 25 modifiers if you feel like you've really kind of done 2 visits, problem-focused as well as preventive care, and so forth. And there's a lot more of detail in here on how to address those things. The Education and Quality Improvement for Pediatric Practice, or EQUIP, is a self-directed online learning program that weaves measurement-based improvement principles and concepts with pediatric-specific content to improve children's health and wellness. The courses help identify and close the gaps in practice using practical tools. These online courses, users learn to document improved quality of care on a continued basis, and this does meet MOC Part 4 requirements. So I will tell you, I completed an EQUIP tool on hypertension, pediatric hypertension, in October through January. And I thought it was a great course. It really is, like so many of the MOC activities, you're really doing your own quality improvement on your own practice. And this was a good opportunity, I felt, to pay more attention to some of the borderline high blood pressure measurements, make sure we were actually measuring the blood pressure properly, and providing education to families about the high blood pressure and so forth. So if you want, that is available online. Resources and tools shared during this portion can be found at the following links. So everything's available. As you can see, it's really all through the AAP Bright Futures links. So to summarize, for Bright Futures, as you saw, there was a focus on healthcare professionals, really what to focus on during a visit, what screening and anticipatory guidance to provide. And when Bright Futures often for many of us is interwoven into our electronic medical records. And so you may have that your visit template for a, let's say, 12-year-old adolescent visit has a number of the Bright Future components already built in, which I think is a really great way to make sure, one, that you don't forget, right? Because very few of us are going to necessarily open it up while we're in the midst of a clinical visit, as well as it's just a prompt. It's for a reminder. And certainly you don't have to use all components. You may just decide to focus on certain aspects based on the needs of the family. But I think that's a nice way to do it. If you don't have that luxury, you may have the option in your electronic medical record of crafting your own note template. And we have done that here at University of Illinois, thanks to some of my wonderful colleagues who have developed well child templates based on age and really brought in a lot of these tools right into the notes. And they're just saved templates that I can pull up. I don't have to use them, but I can choose to use them, which is nice. And they always are helpful for me as I go through my visit to just keep on track as to what is important to cover. The other area I think Bright Futures is really helpful are for those of you who work with trainees. So I found Bright Futures to be almost most valuable in educating medical students and residents about health supervision for children of all ages. It is a really easy, accessible resource, and so this is something we will have students we'll have them read. And we'll use a lot with residents because it is one place where it covers all health supervision for children of all ages. And so it's just a wonderful resource from that perspective. So I feel like as a training tool is one of its most valuable uses. And then don't forget about families. So there's also opportunities to use Bright Futures for our families. And again, this is an area I'm working on to do more of. It's a free resource. It's out there. And many families are interested in having information to think about before or after their visit. So as we talked about, Bright Futures is an important part of healthcare community. The guidelines, tools, and strategies are important to promoting health for children and families. And with that, and we had a shorter presentation today, I'm happy to answer any questions anyone may have. Olivia, were there any types of questions? Oh, go ahead.
Oh, no. Hi, everyone. Thank you for joining us for the Bright Futures presentation. I'm just going to share a couple tidbits, and then we can dive into some questions since we did finish a little early. Sorry. It normally would just go to the end of the slide. Okay, so just a reminder that once again, you will receive an evaluation following the conclusion of this webinar, and it'll be sent the week of May 6th. And then after that, once you complete the evaluation, we'll send you your certificates following that. Since we did wrap up a little early and I don't see any questions in the chat box, I think one of the things that we can, actually, there is a question. So one of our audience members asked Dr. Caskey, what are your thoughts on reaching out to adolescents via social media? Just as a disclaimer, we do have a social media webinar coming up, but maybe you can answer this in the context of like Bright Futures. Have you found any information that you can share on social media from the text or anything?
I think that's a great question. And admittedly, this is an area where I'm working to get better at. And so I think social media obviously is integral to the lives of all of our adolescent patients and our own kids, right? It is absolutely part of their world. And the type of social media we know that adolescents use is different than what adults use, more and more so these days. So I think this is really important. Bright Futures. Well, so there's a few different ways to think about this. Yes, the answer is I think social media is a great way to reach out to adolescents and also to provide snippets of education. Now, as you all know, most social media platforms you're not going to put a lot of exhaustive information. It's really more a shout out, a sound bite, but it's a great way to even say, hey, it's August 1st, it's back to school season. Do time to come in and see your doctor or something like that. And as well as just reminders of the importance of routine visits. Some practices I know who use, now this works best with Facebook, and truly very few teens use Facebook anymore, but their parents might. So, how there's birth dates and stuff linked to those. They've sent reminders based on birth date, because birth date's a great kind of a anchor for a time to come in for preventive care, right? So a lot of parents will try to always do it around the birthday because it's just an easy time to remember. So I have seen practices who use social media and have alerts based on birth date and say, oh, Jackie's turning 12. Let's send a note out saying, oh, happy birthday. We would love to see you in soon for your visitors, those sorts of things. So there's a lot of creative ways to do this. Truthfully, I think we need to harness the creativity and energy of some of our younger or staff members and so forth to help us with this, as I think there's really creative ways that might be appealing to adolescents that most of us may not think to do. And as a quick shout out, that is something we're going to talk about at one of the upcoming webinars, where we're actually getting currently right now input from adolescents on best ways to reach them through social media. So stay tuned. We're all going to learn something.
Okay, thank you for that. The next question that we have is, what expectations should we be setting for preventative care visits once teens transition to adult care?
Yeah, and I suspect the question is about how often. And I'll be honest, I take an extremely pragmatic approach. I realize in an ideal world, and probably in the eyes of the AAP as well as adult healthcare organizations, most people should come in at minimum for an annual visit. And though I'm not at all suggesting that isn't ideal, I believe it is, I also think it's highly impractical. So I often will be just very pragmatic with young adults and say, I'm here. I would love to see you at least once a year for the following reasons, based on screening, discussions, and so forth. If I see you every 2 years, wonderful. If it's every 3 years, fine. I think it's really, we just have to sort of take the opportunities when we can. And then remember, it doesn't mean they won't interface with the healthcare system. They may just not be coming in for those preventive care exams. So when they come in because they, have a UTI, let's say, it's a great time to say, I noticed you have not been in for a routine visit. Could I get that scheduled for you today, and so forth? So again, we have to keep an adult model of care here for our young adults, in that we have to capture them when we can. I think a lot about those acute care visits as opportunities for little tidbits from the preventive care visits, whether it's a quick vaccination, whether it's a quick, hey, I noticed I haven't seen you well. Should we quick talk about your birth control? Those things. And I know it adds to your visit, and it is difficult in the very short time you have to deal with a UTI, for example. But again, those are often the only opportunities we have to try to reach out and just say, look, either let's have you come back, or are there key items that we could quickly address during this visit?
Great. And this is Kathy, Dr. Kasky. And I was going to ask you if you could talk just a little bit about any strategies you're using within your practice to obviously, you want to get the adolescents in, but is there anything that you've seen or done that is helpful in terms of increasing adolescent wellness visits?
I know it's hard. So a few things we've focused on. One has been Saturdays to avoid the loss of school time. So we've expanded Saturday morning hours. Now, let's be honest, not every family, or certainly not every teenager, wants to come to the doctor's office on a Saturday morning. But for some families, that works very well. The other times we try to do is we really try to capitalize on the times, the natural times during the year where they may be more available. For example, the summer. So I say to families, oh my gosh, summer, this is absolutely the time to come in. You have 3 months. Even if you just focus on the month of August before school goes back, there's sort of no excuse for not finding a time during the summer to come in. So I think we have to remind them that that's important, as well as other breaks. So there are breaks around the winter holidays, right? Most of the schools are giving at least 2 weeks off. Some of the schools now get a whole week around Thanksgiving. So again, it forces a lot of scheduling on your end around those times, but often it's when those teens are most available and most likely to come in. So we always have a huge influx during the end of summer, as well as during those holiday times. and we try to keep spots available specifically for adolescents, because we know those are, the infants we can get in other times, but those might be the only times we can get adolescents in the door.
Great. And I was also curious about immediate care. If you have thoughts on that, I know as an adult, being able to utilize immediate care. For example, if I can't get in to see my primary care doctor, but I need to be seen, I can be seen the same day. And I was wondering if you noticed that adolescents are also taking advantage of that, if it's offered.
Oh, so you mean like immediate care appointments in the clinic?
Yes.
Yeah, absolutely. I mean, that's really the majority of what they take advantage of, right? Because they're coming in usually with a focused or acute issue. And so, again, the problem, though, is that every practice is different. And so I realize for some of you on the phone, those appointments that you keep for urgent reasons may be very short. You may not have much flexibility in those. So I know it's not a time we can necessarily turn it into a preventive care visit, but we know adolescents are more likely to use those than any other type of visit. So it's at least an opportunity to remind them to come back, encourage, address a few small issues if you think you can in the context of that visit. But I appreciate the fact that for some of you, those visits can be 10 or 15 minutes, and you really don't have a choice but to focus on the acute issue for which they came in then for.
Hi, thank you for that, Dr. Caskey. So I don't see any other questions from attendees, so I think that we can go ahead and wrap up. If you do have additional questions that I can share with Dr. Caskey, please feel free to reach out to me via email. And once again, we will be sending evaluation links out following the webinar, and also this slide deck will be available on our website at illinoisaap.com. Thank you so much for joining us today, and have a great rest of your day. Bye, Dr. Caskey. Thank you.
My pleasure. Thank you all.